Hey everybody, I have Howard Kaufman from ORL here and Dr. Pearl. And I want you guys to meet Dr. Pearl because she's a periodontist and who knows what that is? Not a lot of it, but she is going to explain to us why she recommends ORL's toothpaste, mouthwash, and breath spray. So, Pearl?
Welcome, Dr. Pearl.
Thank you for having me. Yes, so I'm Dr. Pearl Lai, and I'm a periodontist. So what a periodontist is a dental specialist that specializes in the gum care and bone care, so the foundation that supports the teeth. So if you have gum disease or recession where you're losing gum tissue or you need a dental implant, you would probably see a periodontist. So yeah, Dr. Pearl Lai, and I practice in the mostly Arvada, Boulder, but Denver Metro in general. So do you want me to go into the product, Jenny?
That would be wonderful. I know your number one thing that you recommend, even though we have this 3-step process, is the mouthwash. And when everybody know now, it's 200 milligrams. And you can now see if you're running out. I think on this it's easy. But she's first going to discuss that, then the toothpaste, because when you're getting this gum work done, sometimes you can't brush your teeth right away, but you can use the mouthwash. And then she'll talk about the breath spray too.
Yeah, so after gum surgery and dental surgery, we usually prescribe patients chlorhexidine mouth rinse. So we were using that for quite some time. It's also known as Paradex, and that's really what a lot of dentists and surgeons have been using, but it's quite detrimental over time. It actually prevents collagen healing. So was looking for an alternative for our patients to use after their healing. And so we are now moving towards ORL because of the CBD, but there are non-CBD options as well. But we like the CBD because it has antibacterial and healing effects. So this has been our game changer in the healing because again, the chlorhexidine can inhibit healing if not used properly. And even when it is used properly, research just shows it inhibits fibroblasts. And fibroblasts are the things that put down collagen. So I was actually thinking like, I need to make a CBD based mouth rinse or product line for my patients because we need an alternative to what we've been using. And literally 2 weeks after I said this out loud, this product showed up in the office. So patients started asking me about it, and I said, well, I need to test it out for myself. And now this is the product I use, and I love it. And so that was it, you know. So there's research to show that CBD is supportive in oral health, amongst other things. So we started recommending the oral rinse because patients can't brush for a certain time after their surgery. But then I actually really love the toothpaste personally. I think that's my favorite product. So now I have them
up to 150. So now we have 150 milligrams, you guys, and that is really high for toothpaste. Well, it's the highest for toothpaste because there aren't any other toothpaste that have CBD in them that are that high, right?
Right. So there's not a whole lot of products out there, but I love the packaging. I love that it's in glass. Yes, and then the mouth spray.
Yeah.
It's actually really, I think my patients will really like that because they can't brush for a week. And the biggest complaint is my mouth feels gross. When can I brush again? So having the mouth spray afterwards.
And this is recyclable, you guys, it's glass. So everything that you'd be purchasing to help with your oral care is all in glass. And Oral has done that for a reason because they were finding that a lot of the plastic containers of the mouthwashes that we all know, toothpaste that we all know, the rubber or whatever they're in is leaching into the product. So is organic or whatever they say all natural? It's really not because you're getting leaching of the glass, not the glass, sorry, the
plastic. Yeah.
The plastic. Thank you.
Yeah.
It's not the glass. The glass is what's going to keep everything fresh longer and safe. And actually, these are made out of glass, correct?
It's out of glass, and it's glass that's endlessly recyclable too. So even though there are some plastics that you can recycle, but you only can recycle them a couple of times before they degrade.
Right.
Dr.
So the breath
Lai,
spray, really quick, the breath spray, like I said, this is glass right here. This is plastic and this can be recycled. just so you guys know.
So Dr. Lai, I was just going to ask you, typically, like, what are some of the serious things that you see as a periodontist with patients, and what can we do to basically ensure that we're doing everything possible from avoiding to see you, I guess, is really the question.
Oh, yes. Yeah, actually in the perfect world, I actually wouldn't be in this line of work at all, right? Because we wouldn't need periodontists, which I think that would be a beautiful world to live in. So some basic things you'll hear about is, just good general dental care. But I really look at healthcare as a bigger approach. So it's not just what whether you're brushing or flossing. What are you eating? Are you eating organic foods? Are you eating GMOs? Are you eating artificial dyes? Like, what's the toothpaste that you're using, right? You're exposing yourself to these chemicals. So it's really a whole health approach. And I think that's on all levels. The mouth is part of the body. Okay, the body is a part of this, mental health, emotional health, spiritual health. So I really see healthcare as not even just our bodies, it's our emotions, it's how we go about life. So reduce your stress, eat well, smile and be happy, and also believe that your body has this incredible ability to heal. It just needs help sometimes. That's where, the products come in. That's where a periodontist comes in, where you come in and make individual decisions about your food, exercise. But also having faith in your body. It's incredible. It can do a lot of things. Yeah, I think
that's a wonderful answer. I'm like, that's a wonderful overview. Positive ending.
Yeah, well, we'll have to talk again as a group, for sure.
Yes, Dr. Pearl, thank you so much for coming on tonight. We really appreciate this. We've been waiting for a doctor to come on to talk with them and speak with everyone. And so if you guys have any questions, you can go to Jenny's, it's JENNYS gold.com if you want to order any of the ORL products, or you can go to Facebook and like Jenny's Gold Standard, and you can you don't even have to like it, but I'd like it if you like it. And then you can find the ORL website link there too to get 20% off your products. They have 20% off their products, you guys. Come on. Can't get a better deal than that. So anyway, please go and see Dr. Pearl if you need to find a periodontist and on the Denver area, Arvada, etc. And she'd love to meet you. And we're so glad you guys were able to listen to us this evening. Thank you
so much.
Thank you.
Bye, guys.
Bye.